Thank you everyone for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Life Experience Informing Careers in Dementia Services and Supports, a panel discussion. The National Alzheimer's and Dementia Resource Center is supported by the Administration for Community Living. And before we start, Erin Long of the Administration for Community Living will provide a brief welcome. Erin.
Hi, everybody. Thank you so much for joining us today for this particularly exciting webinar on life experience. I just want to take a minute to thank our excellent caregivers as speakers / service providers, Sally Bolin, Athena Fletcher, Stephanie Hughes, and Stephanie Shivers. We're super excited to hear what you guys are going to tell us about your experiences and how it informed your work. So with that, I'll send it back to you, Sari, and look forward to the presentations.
Great, thank you so much. So if you've joined us before in the past, this will be a little bit different than our prior webinars. Our panelists today are Sally Bolin, Athena Fletcher, and Stephanie Hughes, and our panel moderator is Stephanie Shivers. We're going to start with some brief intros that the panelists will give themselves, and we'll start with Sally Bolin. So we can go to the next slide. Sally, go ahead.
Thanks, Sari. It's great to be with all of you today. My name's Sally Bolin. I'm the president and CEO of Memory Lane Care Services and the Ohio Council for Cognitive Health. We're a home and community-based organization that provides support and services for individuals living with dementia and their caregivers. I've worked in the field for almost 30 years. I'm a clinical social worker by training. These are some photos of my parents who I helped care for. My mother had vascular dementia for about 6 to 8 years, and I was, privileged to be able to be her caregiver. One of the things with these photos is I'm from a very large family. I have 7 siblings, which is certainly unique from a caregiving standpoint. Also, while you're working, and my caregiving experience, also at the same time I was raising my children. So thank you so much.
Great, thank you. And now we'll have Athena introduce herself.
Good afternoon, everyone. I'm pleased to be here. And my name is Athena Fletcher, and I am an absentee Shawnee Tribal Health member, and I work for the absentee Shawnee Tribal Health System. And our health system is basically situated in a rural area, actually in about 9 miles east of Norman, Oklahoma. Now, I basically joined the health system several years ago, and before I joined the health system, I was a caregiver for my mother and my sister. And in the photo that you see on your right is my mother and my sister. And I have a long story about how I went through the journey with dementia. And so it's just a pleasure pleasure to be here to share my experience.
Great, thank you so much. And Stephanie Hughes.
Hi, everyone. Good afternoon. My name is Stephanie Hughes. I work for RTI International, and I've been part of the National Alzheimer's and Dementia Resource Team for about 10 years now. I've worked in the field of dementia for about 20 years. My background is in public policy. And so I currently work with ADPI grantees, helping them plan, implement, and evaluate their programs. So my experience with caregiving came many years after I had already been working in this field. My mom is now in the late stages of dementia, and I've been a caregiver to her for the past couple of years. I am also one of many, many sandwich generation caregivers, and look forward to sharing about those experiences today. I wanted to share these pictures of my family just to emphasize that the caregiving experience really is about the whole family. The whole family is involved, and it impacts everyone. So thanks for having me here today.
Thanks, Stephanie. And now we'll move to Stephanie Shivers, our moderator today, who will give a brief intro, and then we'll move into the panel discussion.
Great. Thanks, Sari, and everyone. It's a pleasure to be with you here all today. So I'm Stephanie Shivers. I'm the Chief Officer and Vice President of Program Development at Caring Kind, based in New York City. We're a not-for-profit community-based service organization, and I've been working in dementia services for about 18 years. I became a long-distance caregiver for my dad, who died of vascular dementia about 3 years ago after I was in the field. And I'm currently a long-distance caregiver for my mother and power of attorney for my mom, who is refuses to get diagnosed, but it's definitely living with cognitive changes. And so it's truly a pleasure, I think, for all of us. We're all really excited to be here on the call with you all today. So let's get started. And I think maybe I'll start with you, Stephanie Hughes. Why don't you tell us a little bit more about your caregiving experience?
Sure. So my experience, it was moved very slowly for many years and then all at once. My mom's dementia, I would say, progressed really slowly for many years. And for a long time, she was living at home with my dad. You know, he was sort of, as in many cases, he was sort of gradually taking on more caregiving for her over time. And we were trying to support him from a distance. But then he became very ill with a very aggressive cancer quite suddenly. And so my sister and I sort of overnight became caregivers to both parents. He was sick for about 2 months before he passed away. And during that time, we needed to move him up to Chicago to receive care, which meant we were also moving my mom to the area. So there was a lot going on during that time. We moved her into a memory care facility during that time. And so it was quite intense emotionally and logistically for those couple of months. And then, you know, since he passed away a couple of years ago, we've been on this, you know, a little bit slower, but still sometimes unpredictable path with caring for my mom. So that's a little bit about what our path looked like so far.
Thanks. And so, you know, can you share a little bit, how would you say that your caregiving experience has deepened your understanding now of dementia services and supports?
Yeah, I mean, a couple things. I mean, first and foremost, it's for sure given me a much greater appreciation for the value of the kinds of supports and services that we're all working on every day. It's given me a much greater appreciation just for the complexity of different kinds of caregiving situations and the fact that there is not necessarily a one-size-fits-all approach for all families. It also honestly was quite eye-opening for me, just to the fact that, you know, I'm used to in my day-to-day work, I'm working with all of these project directors who are starting up great services in their area. But when I was in the process of supporting my parents from a distance and we were seeing that my mom needed some more supports, I was quite shocked to learn that there really was very little available in their area, despite the fact that they lived in a mid-sized community that otherwise was pretty well resourced. So that was quite eye-opening. But the other thing that I would say, I guess, was just given that a lot of our experience was sort of this very like acute crisis-oriented time, for sure the value of that, whether it's a care consultant or care navigator, like someone who can play that pivotal role of being like a point person when you're trying to figure out all the different things that you may need, I think is hugely valuable. Particularly someone who can bridge between the healthcare stuff going on and the other community, you know, home and community-based service resources. We unfortunately didn't have like that key point person in our situation, but at least I had some knowledge of the kinds of things that were out there. But, you know, even having that knowledge, it was kind of overwhelming and humbling just how challenging it can be to try to look into all of that at once.
Sounds like the new care models, or the care models that we know that have the evidence behind them, that have a navigator really working directly with families, is something that resonates with your situation for sure.
Absolutely.
Yeah, thanks. Sally, let's move to you. Why don't you tell us a little bit more about your caregiving experience, and then, you know, how did your experience impact your work?
Sure.
So I helped to take care of my mother first. My mother had vascular dementia, and she lived with that for about 6 to 8 years. And then during the time that when my mom was toward the end of her life, my father developed cancer, and so then I rolled into that caregiving role. And similar to what Stephanie had, is as time went on, I assumed more and more responsibilities of helping to care for my mom and support my parents as best as I could. Coming from a large family is always is interesting. I'm the seventh of 8 kids, so I am one of the babies. And you know, certainly my experience with my own family, I think, has played a role in helping me to appreciate and understand some of the unique dynamic situations that families bring to the table when they're caring for someone in their family who has dementia. And at the same time that I was caring for my parents, I was in a sandwich generation. I still had a son at home who went through middle school and high school and started college throughout the time that I was taking care of my parents. So I was juggling that balance of work and family and caregiving, which I know all of us see from day to day, but you know, seeing it at work and living it at home certainly was a double whammy for me. And then from a work perspective, as my caregiving responsibilities increased, it was challenging, you know, certainly, and I know I'm preaching to the choir here, but challenging managing work and my family and caregiving. And I realized as my mom's dementia progressed that I needed to make some changes in my life. And I was very fortunate at the time that a job opportunity arose that that allowed me to take on a different role that had less responsibility, less travel. So I made some pretty significant changes in my work life in order to adapt to making some, you know, some changes in my personal life so I could help take care of my mother as her dementia progressed. I know that's not always plausible for people to do, but it was certainly something I was faced with, and was grateful that that opportunity arose for me so that, you know, I could help take care of her during the time when she needed me. And similar to what Stephanie said, so that was certainly a challenge, you know, making, and I think we read and we hear about that a lot, is, you know, sometimes caregivers are forced to make those changes, and having to do that was something I certainly experienced in my life.
Mm.
And then, you know, similar to what Stephanie said, you know, I think as someone who's worked in the field for a while, I realized that, you know, systems are fragmented, and, you know, different parts of, you know, country might have more services than less. And I actually, one of the reasons why I became the primary caregiver for my parents is because I was the adult child for a good bulk of the time that my parents needed support. I was the only one living in the community where they lived. And so, so living in a community that I was familiar with, where I had worked for, you know, 20 plus years, it was really quite humbling and overwhelming and frustrating for me at times when I had trouble navigating the system. And I think from you know, work perspective, that has really made me more passionate to think about, you know, what are the little things that we can do as an organization that could sometimes make a difference. You know, sometimes when I had to go and you know, call 3 or 4 places just to make one appointment, you know, and I was tearing out my hair for my mom, you know, being able to, from, you know, my standpoint now at work, looking at ways of just the little things that we can do to make, you know, things a little easier for families can really make a powerful impact. And I think some of my personal experience of dealing with that with my mom really made an impact on me and has motivated me to kind of look at sometimes how we're doing things within our own organization to improve, you know, quality for the lives of our families that they're living. So
That's great. Thank you. Thank you. Lots to think about there. Lots of shared experiences for sure. Athita, let's give you a chance. Why don't you tell us a little bit about your caregiving experience?
I think mine was a little bit different than Stephanie's or Sally's, in that when I retired and moved back to Oklahoma and I resided with my mother and my sister, I had no idea what dementia was. I didn't even know the word. I didn't know what Alzheimer's was. And my mother at that time had been told by a doctor that she had experienced little strokes, in her brain, and that's about all we heard or understood. And so I didn't know what was going on with my mom, and I didn't know what was going on with my sister. So during that period of time, there were a lot of challenges that we experienced because my mother lived to be 95 and my sister lived to be 84. And so my sister was the primary caregiver, and then I kind of was the backup. And so during this period of time, my sister was never diagnosed and my mother was never diagnosed. So now that I know about uh, what dementia is and Alzheimer's, I realized that both of them had Alzheimer's.
Mm.
And had I had that knowledge at that time, I think a lot of approaches and caregiver needs would have been met a little bit more easier. And the family would have been a little more engaged. But those are things that where I realize now that how important that education is to know about dementia and Alzheimer's and all of the diseases that affect the brain. So
Right.
that was
That's great. So it sounds like, you're a little bit different than the rest of us in that you got into dementia services after caring for your mom and for your sister. And so
yeah.
given those experiences, sounds like a couple of things have probably percolated up that are important topics for you. So what are some topics in your work that are really, primary and are really real issues for you now?
The education. I feel like when I lost my sister and my mother, I was at that time I had just joined the absentee Shawnee tribal health system, and became the director of the Alzheimer's Disease Program Initiative grant, and then I began to learn what dementia was and what the disease Alzheimer's was. And I realized, well, both my mother and my sister had this disease. And then I thought, well, I didn't even have this education. So education for all of our communities about what this disease is and the challenges that the caregivers are going to be facing is extremely important.
Mm, that's helpful. Thank you. Thank you. Stephanie, let's come back to you. So you worked in the field for several years before becoming a caregiver for your mom. And so how has your work experience informed your, how's it informed your caregiving experience?
Yeah, well, actually, piggybacking on what Athita was just talking about, I think that is sort of the first piece is just having some of that, basic dementia knowledge was hugely helpful. Just knowing kind of what some of those signs and symptoms were, what kinds of things are normal or not normal with aging. I think I was maybe not the first one in my family to notice things, but maybe the first to kind of put together, like, I think this is what is going on here. So just having that awareness was very helpful. But then having some of that understanding of the landscape of services that exist. Again, in the case of my parents, it didn't mean they didn't necessarily have what they needed right there in their community, but then we were able to look for other avenues to get them what they needed. And I have just thought so many times about some of the things we take for granted, like, oh, okay, of course I know there's sort of this suite of different types of programs of, caregiver training or support groups or adult day services or whatnot. But I think so many people don't have that initial knowledge. And so I think it just really underlines the importance of some of those programs that a lot of our grants are doing to get out and educate people about what exists. So for me, there's been a lot of value. I've been really thankful to have the knowledge that I have from my work experience, it doesn't take away, like Sally said, the emotional challenges with that you come across, but it is really useful to have that knowledge and just to kind of have some understanding of how to navigate or what kinds of resources there might be.
It sounds like, it's almost like you had enough knowledge to not even just know, you knew the first kind of line of defense or the first thing to do, but then you also even had kind of how do I pivot if these resources aren't available? How do I pivot to this? Whereas a lot of people don't even have, as Athena was saying, that first primary understanding of what resources are available and what it is that people need. Your situation, Stephanie, is similar to mine. So the two Stephanies have a little bit of a shared experience, and that, I was working in the field. My grandmother had dementia, and when I was very young and of a different era where she was tied into a wheelchair and, on, significant medications and unable to speak or really, do anything in her end days. But I was not actively working with, and I didn't have anybody kind of in my immediate family as an adult that had dementia until my dad started showing symptoms of vascular dementia. And I'm an occupational therapist, second career by background. And so for me, one of the, how has my caregiving experience shifted my work experience? As an OT, we're all about home and keeping people in their home environment. And something that I came to realize with my personal situation was that home is not always the best place for people, that some people actually do need, a different level of care and a different level of support, and that it really is person dependent. And so, home can be very isolating for people, especially if they don't have, are in rural settings. And so that was definitely something that I had to kind of recalibrate on. And I think another thing too is that, I've always been focused on what's best for the person living with dementia, what's best for the person living with dementia long term. And in reality, I realized that, we have to think about the long term, what's the best long term scenario for the caregiver as well. And so it might actually be that a move is going to position, the family, the spouse, particularly the spouse, in a different situation that will be better for them in the long run than, after the person with dementia dies or walks on, as Athena says, setting that family caregiver up for long-term success may be, a better thing. So I've just had to kind of rethink things that I was a little bit more dogmatic on, that now I realize that it's really, not one size fits all, and the best solution is going to be the best solution for one particular family and not necessarily the best solution for everyone. So Sally, given your caregiving experiences, I'm going to circle back a little to the question I asked Athena, are there particular topics in your work that you particularly identify with now?
Yeah, I think one of the things that has really kind of hit home for me, and part of that came from caregiving with my mom, was what was real important with me to help, preserve what she was still able to do, and really making the most of every day and doing that practice of being in the present, right? And so during that time with her, I can remember on almost every week we would do things together, and and I really focused on what she liked doing, what she was still able to do, and really making the most of every day. And I think that's really, and I believe that, and I practiced that before, but going through this from a personal experience with my mom, and really wanting to preserve her integrity and her dignity. That has become even, I think, more important for me, you know, and not that it wasn't before, but you know, one of the things that, you know, I think a lot and we talk a lot about, you know, through work here is what we can do to make the most of everyone's day. Where I work, one of the things that we do is adult day services. So we have people, you know, in our building every day, 5 days a week. And one of the things that is a good day is when people who come to our center have a good day. You know, they're making the most of the present, they're enjoying themselves, and we're focusing on what they're still able to do. And I think my caregiving experience has really emphasized that for me even more, in something that we're trying to live out in our day-to-day work that we did. And again, it's not that we didn't do that before, but that experience with my mom and the importance of, you know, when we were out at a restaurant, we were at the grocery store, she was still seen for the person that she was, is really, really important, and making the most of that day and living in the present at that time with her. So
I think you've talked a lot about kind of family dynamics as well. And I think that's certainly something that I've seen historically and in my practice over the years, that, you know, every family has family dynamics, and navigating family dynamics can be really challenging. And I do feel like I'm often at a loss for resources for family to kind of learn how to mediate some of those challenges. So I plant that seed out there for people who are in program development, because I feel like it's a gap area that we're still, you know, I don't know if any of you all have had different experiences with that, but I think that that's, you know, navigating families as a social worker, you know, is that's a good spot for you to be. I'm sure you make a difference in that area for sure.
I hope so. You know, growing up one of 8 kids, you know, there's lots, you could probably have a full day webinar on that.
A week training on that, I think.
Yeah, maybe a degree. Yeah, you're absolutely right. I think, you know, similar to like Althea and Stephanie said, is, you know, working, and you said too, Stephanie, is, you know, working with one family, you know, is working with one family and meeting their needs where they're at is so, so important. And, but understanding that, you know, different families come to the table, you know, with different things, and even that, you know, sometimes I think the education level, you might have, you know, 4 or 5. I found that with my siblings, you know, I think the 8 of us had some basic understanding, but we were at different levels of understanding. And, you know, so coming to the table and having discussions, sometimes we had to spend more time with, you know, and I think that's true with lots of families, with maybe, you know, one family member over another, to provide that education and support.
Right. Thanks. Athena, let's come back to you. You know, so given your lived experience, what do you find kind of most rewarding now about the work that you're doing in dementia care?
Oh, the most rewarding for me is the fact that we get to go out into the community and deliver our information. And also, we host events where we actually give educational training about what dementia is. And whenever we're doing these educational trainings or present the education to the community, it's like whenever we start teaching the different challenges and the different symptoms of the disease, seeing those individuals who are actually living with dementia at that time with one of their family members, to understand that, oh, is that why Uncle so-and-so did that, or Mom did that? And just seeing that switch of that light, just like all of a sudden it just dawns on them, well, this is what's going on with my loved one. And that's what's really beneficial to me, or rewarding to me, is to see that we're making an impact. Our education is opening those minds to, hey, it's just not normal. It's not normal aging. This is actually a disease of the brain, and it needs to be probably approached a little bit different than what we ordinarily would do.
Mm. I love those light bulb moments, and it's wonderful to be able to actually give that light bulb moment to someone where you're giving them a little bit of new knowledge, which helps to connect the dots and helps the pieces. I think it's also rewarding too. A lot of times when we're working with people, you don't necessarily see the direct impact of the work that you're doing. And so I love those moments where you see the change happening is really, really rewarding. So thanks for sharing that.
Yeah.
Stephanie, let me ask you the same question. What do you think? How has your lived experience made you better at your job?
Yeah, well, I think first, it has just given me such a different perspective. A lot of our work is like one step removed because we're working with people as they're planning these services, but actually seeing some of these, seeing services being delivered. I visit my mom all the time, and it's been really fun getting to know so many different people where she lives and just kind of seeing the different flavors for how dementia may present, and also kind of getting more of an appreciation. I feel like a lot of our projects are doing training for professionals on what is good dementia care and what does that look like, and really being able to see in real life some of those variations in care based on people who really understand some of those skills of how to deliver dementia capable care versus not, has been educational. I think from the caregiving perspective, it's also just, this is maybe similar to something you said before, Stephanie, which is just giving me a more holistic view of the caregiving experience, because I think, a lot of our work is very focused on like, okay, what's best for the person living with dementia? Or when we're thinking about caregiving, it's kind of like, okay, how can we help this person become the best possible caregiver? All of which is super important. But I think just it's given me more of that whole family perspective too, because, as somebody in the sandwich generation I'm juggling lots of things. I have 2 teens and I work full time, and, lots of commitments in addition to helping care for my mom. And I know I want to help her have the best quality of life possible. And I also know who she is, and that she would not want, me to not have the time with my kids and things like that. So it's just, I don't know, it's just given me a different view of like, how can we just support families as best as possible, again, to make the decisions and choices and get as many supports as possible so that everyone can have the best experience possible, and also realizing like it's not perfect. And every week, the priorities are shifting and you're rebalancing, and it's not about like finding like the right answer, but kind of trying to do the best you can as you go along. So I think that has just helped give me a more realistic and holistic perspective on kind of the goals of what we're doing.
That's helpful. Sally, what about you? What do you think? How has your lived experience made you better at your job?
I think one of the things that I've found is I'm not so prescriptive with things like I maybe used to be before. I feel a little bit more in touch with my empathy, for caregivers and people who are living with dementia. And it's really I think really reinforced to me the importance of, one size doesn't fit all. You need to meet people where they're at, and even though, sometimes I think, there's so much more that could be done, but if they're not ready for it, they're not ready for it. And so you have to meet them where they're at and build and grow from there. And so I think that's one of the things that I've learned. And you don't have to do everything at once. Sometimes you want to do everything at once because you want to, help people so much, but sometimes it's just one step at a time. And I think part of my caregiving experience really shaped that, because sometimes there was only so much I could do, or there was only so much my dad could do. And, we needed to take it a little bit at a time.
Sally, you said something earlier that raised a question in my head. You talked about how you realized that you needed to take a step back and to kind of pivot from your work. And I'm wondering if you can share a couple of, examples, like what did you notice? Like what were the signs that you picked up on that were like your cues that, oh, I'm going into dangerous territory if I stay in this situation?
Yeah, there was a couple things. I remember there was a couple times at work, like something happened, like my dad called me and he needed me. And I like there were several times I like literally picked up my car keys and I walked up to the front desk and like, I have to leave. And I just left. And eventually I came back to the office at maybe 8 o'clock, 9 o'clock that night to gather myself up. But that happened more than once. And I was just like, and so I realized something needed to give when those things started happening. The other thing that I think started happening, and this was like the whole, and I think a lot of people experience this is, I was trying to juggle work. I was trying to, be there for my parents, and I was trying to be there for my family. And so there were days, I'd come into work at 8:30 at work at 7:30, 8:30 in the morning. And my mom came to our adult day center for a while, and I would be here. And then from there, I would take her home. And then from there, I would drop my son off at school on my way into work. I'd come to work. I'd take my mom home. I'd get home at 9, 10 o'clock, 11 o'clock at night, and I'd start all over again the next day. And I realized after doing that for a couple months, I'm like, I can't continue doing this. It was just too much. And so I, spent some time thinking about, and I think my work also informed my personal experience too. And I kind of knew what the future held for us and realized, I needed to make some changes and make some decisions about what was important to me in my life and then go from there. And so that really is what instituted a lot of the job change, were those factors, is just the craziness of my schedule. And then just there were multiple instances where I had to go, and because my mom was a priority, and I just left everything at work. And that just, is not something a lot of places you can do for long periods of time. So.
Right, right, right. Thanks for sharing that. Um, Athena, I'm curious, I'm going to come back to you. So I'm sure, we have a number of people who are on the webinar today, and I'm sure that we have several kind of directors and managers. And so I'm wondering kind of what advice would you have for team leaders on how to care for their caregiving staff? What would have helped you most during your early caregiving days?
Well, firstly, I believe that the leaders need to understand what dementia is, what it actually is, and also the impact that it has on families. And so our health system is in a rural area, and so that family orientation goes a long way whenever you if you have a good employee and you allow that employee some flexibility and you have the knowledge that they're caring for someone at home with dementia, balancing that a little bit or giving that flexibility so that they can meet both the needs of their loved one as well as the organization. And I think that's a win-win situation for both the organization and when you have to be a caregiver, because they're both very important. And when you do have a good employee, there needs to be that flexibility, and management needs to understand, what the challenges are and how that disease impacts a family.
I appreciate you saying that. I'm just thinking, Sally, of the example that you used, right? You had to go, and then what did you say? And I came back to the office, till like 9 o'clock at night, because you're still, your loyalties are divided, but you're still, trying to do, all those work. So having, the flexibility, maybe there's a way, we can increase flexibility in a meaningful way. Stephanie, I'm curious, what advice do you have for team leaders, on how to care for caregiving staff? You're in it.
Yeah, I mean, I would say a couple things there. I guess first is I think a lot of us think in terms of like policies or benefits, like, oh, okay, there's FMLA or, people have access to X amount of time off or that kind of thing. But I think so that's the first step is whether those benefits or policies are in place for people, but then it's really like the values that are conveyed in the workplace. There can be so much stress in these situations. And that was an area where I considered myself extremely fortunate because I felt like my employer is very much supportive of its employees. And I've worked with teams that are super supportive and other people on my team who've had experience with caregiving themselves. And there's just no replacement for kind of knowing, like, if you come to your work, nobody wants to have to go to their boss and say, like, I'm not going to be able to do my full job for a while. But to know like that people understand and are going to support you and that, we're kind of all helping each other out when that's needed is huge. So, yeah, I think that's kind of like a values thing within the workplace is what kind of values are demonstrated to your employees. But the other thing I would say, I think going back to that time period when my dad was sick and it was such a flurry of activity, like it was truly the most overwhelming thing I've experienced. And so I think having an understanding that caregiving is not always linear. There can be all these, blips in the road where things are suddenly in crisis mode. And just understanding that, like, when people are very maxed out and stressed out, like, it can be so helpful just to check in and initiate something for them to say, hey, I put together these bullets on, this is who you can contact if you need to talk to someone in HR, or just initiating those conversations because they may not have, even if you know what stuff is there, it's like you may not have the bandwidth to sit down and plan if you're just like truly trying to get through each day and like, okay, how am I gonna get my mom over to visit my dad today and put in my work hours and make sure my kids have something to eat for dinner. Like there's no time to then also stay up 3 hours, till, I mean, you could stay up till 2 in the morning, but like Sally said, that's not sustainable very long to be like researching how do I go about filling out this form and, applying for this benefit? Like, some of that stuff is very complicated. So, anything you can do to sort of initiate those conversations or initiate some help, I think is really good. And just checking in periodically to say, how are you doing and how's your workload and stuff? Because sometimes we just get caught in that mode of course I have to be doing all the things. And so I think, yeah, being proactive can be really, really valuable.
I like the term on-ramp, easy on-ramp. I want the easy on-ramp in my life in general. And I think that any way that we can make an easy on-ramp for somebody who's caregiving is a wonderful gift to them. So, and I think you gave some practical strategies there, which is terrific. Sally, I asked about, what can team leaders and employers do for their staff? I'm going to ask you, what advice do you have for any of your, colleagues or people who are in caregiving right now? What can we as colleagues do to help support our caregiving colleagues?
Yeah, I know one of the things that I think we always talk about is your health and your family come first, right? And because I think if you don't have those in some semblance of order, then it's really hard to get your work done. But I've always talked to and thought about, there were days where it was okay for me not to be okay. There were just some days where, and those were the days maybe we all have mundane stuff we have to do at work, or you have to close the door and enter all this stuff into a spreadsheet or whatever it is. And so some days when I recognize that I wasn't okay, or if my colleagues are not okay, it's okay sometimes best to not be 100%, but maybe you can do some other things on those days, and giving yourself some compassion, to be able to work through those things, I think is really, really important. And also allowing yourself the time. Sometimes, Stephanie was talking about it, and I think Althea and I have talked about it too, is that, sometimes the flurry of everything that you've gone through, like now when I think back of some of the things I did, I'm like, I don't know how I did that. I just don't know how I did that. But so allowing yourself to, feel the emotions that you have, and taking a minute to take a breath, and realizing that how this is impacting me, and then what changes or what I might need to do so to work through those things. And one of the things, because my parents have since passed, and I've realized over the last year or two, as I've worked through the grief, is that I think for one of the things that I want to be I guess recognizing as I continue in this career, is that as my colleagues have family members who pass away, there's some time after that too where they still are working through some things, it's still impacting them in different ways, because I'm experiencing that. And not that it's it necessarily is always related to me, but just being sensitive to that, I think is really, really important too, because I think that there's some time afterwards too that it's really important to pay attention to yourself and your feelings, and work through the things that you need to work through. So those are some of the areas I think that are real important to pay attention to with your coworkers.
Mm-hmm. One of the questions in the chat is about, those of us who are in the field, right? It's like there's what we know in our head, and then there's what we do in our actions. I'm notorious with this with my mother right now, where it's like, okay, I know what needs to happen in here, and we're having this all the time. And then, I step out of that situation and think, oh gosh, like I totally botched that up, and, put into practice like what but it's very difficult to be both a daughter and, have this professional mindset. And then, of course, I feel guilty about that, and I should know better. I should be able to do better. I should be able to handle more. We live in the worlds of kind of should. And so I don't know whether kind of any of you, have identified with that, or if you, can speak to that, just that the guilt of, how do you handle that? The guilt of feeling like I should be able to do better, or I should know better, or I'm failing kind of in this situation, even though I shouldn't be. Ever felt like that?
Oh yeah, actually a coworker
Never.
and I talked about, yeah, multiple times. A coworker and I've talked about that too. And I think one of the things is probably we tend to focus more on the negative sometimes too. And so in a day, it may have been that you did 70 amazing things as a caregiver, but there was one thing where you lost your patience, but that's the thing you focus on, right? In my a co-giver and I have talked about that, because we still have some guilt about, the times that we lost patience, or, got frustrated with things. And so, I think, recognizing that you're human, and we fail all the time, right? And that's just part of being human. There's lots of beautiful things I think we all do too, but that's just part of being who we are. So, yeah.
And I
Steph,
think
Anita, you want to say something? Yeah.
I was just going to say, I think sometimes there is this idea, or at least this is something that I've carried in all different areas of life, where it's like, if I just know the right way to do this, then it should all go smoothly and perfectly. Like when I was having my kids, it's like you read all these parenting books and it's like, oh, it's so logical, do X, Y, Z. And it is incredibly valuable to have that, those educational resources. But I know I've experienced that so many times with my mom. One of her things these days that's, it's been this way for a couple of years, is just she has certain questions, and this is like primarily our interactions are that she asks these same certain questions. And that's the flow of our conversation. And I can, do all the things to try to get at what's the feeling underneath this, or is there some way to divert and all of that. And but like Sally said, it's like some of it is just giving ourselves and other people grace to be where they're at right now. And it's like there isn't any magic answer to this situation. It's just having some acceptance and patience and of ourselves too. When like, if I know that if I have had a really long day or I didn't get enough sleep or one of my teenagers was really, challenging earlier in the day, like I always try to be very patient, but some days are just better than others, right? So,
Right.
yeah, I think keeping it all in perspective is good, and not setting ourselves up with expectation to be perfect, especially when, if you're working in this field and you feel like, oh, I should, again, should know better. I should know the right thing to do.
I'd just like to make a blanket apology to kind of everybody in my past that I gave bad advice to, prior to being being a caregiver. There's a question that's been asked about long distance caregiving. I mean, I know that, I've been in a long distance caregiving situation. Stephanie, I don't know whether, any advice or, particular experiences. I think a couple of things for me on my lessons learned. So with my dad, I was long distance and he was married not to my mother. My parents have been divorced for a long time. And so he had, his wife was the primary and I was the secondary. And that's challenging when, you have differences of opinion. And so I think recognizing again the family dynamics in there and realizing that there's certain things that I can do from a distance and other things that I actually can't, I'm not living it in that situation. It just, we have to, I think that's something that I learned. I had to be conscious of that line there. I don't know, Stephanie, if you had any, or if any of the rest of you have any experience of that.
Yeah, I mean, we were dealing with some of that, before my dad got sick and kind of trying to support him from a distance. So I think, similar to what you were saying, there were certain things like driving where we had a lot of conversations over a long time and, my parents weren't quite ready to make that change yet. And like you said, it's like had to accept like, okay, I'm not in control of this. I can give some support and advice. But it is actually, I think, I don't know, maybe our situation was unique, but I did feel like that piece, the geographical piece became very challenging when my dad got sick because again, we had to move him and it seemed like no one we talked to was quite prepared to know how to support, and it just made things extra overwhelming because they were both needing care in a location different from where they had been living for 40 years. And so it was just a lot to sort through. And I think, I don't know, I was thinking about that again in preparation for this, like what would I do in retrospect? And it's like somehow you need to kind of figure out who those resources are in each location. It's like there might be some supports that you can get locally for yourself, but then figuring out like who those point people are in the location where your loved ones are so that you can kind of be coordinating between the two. But it does really add a lot of extra challenge for sure.
Right. I just want to tell everybody in the audience that we've got about 5 more minutes. And so if you've got a question, feel free to put that in the Q&A and we'll get to that. And while people are kind of pulling their last thoughts together, Athena, there's a question for you. In your particular situation, you talked about, you needed knowledge. And so I'm curious, can you share what education topics and skills do you think would have helped you care for your mom and your sister? You've already, talked about like understanding what dementia even is, right? And I'm wondering, are there other topics that you can think of that would be helpful for education or building skills?
Really, the main thing is to get that diagnosis. My mother and my sister were never diagnosed with dementia, but I realized that after I joined the health system, that's what both of them had. And the resources I believe that would have been beneficial is primarily having those periodic checks with your primary care physician. I mean, that is so important as the person experiencing dementia moves through this disease. There needs to be checks made so that you can understand what the challenges are going to be, or what phase that their loved one is in, and how to cope with those. So having that connection with your primary care physician is extremely important, and getting that early diagnosis is extremely important. And so the family can really manage this disease and help with a better quality of life for their loved ones if they get all these different resources involved, and the family gets engaged, and having making sure that the primary caregiver is being helped to relieve the stress and the burden, because it is a challenge caring for a loved one that has dementia.
That's a good, let me follow up on that, because there's a question about respite. Did any of you kind of take advantage of any formal respite or informal respite? Any experience with that, or things that you'd recommend?
My sister did have a program that where she would get some relief for like 4 hours a day, because I wasn't there 8 hours a day either. So she did have that little bit of break. So that was very beneficial for her, because she was the primary caregiver for my mother. And even with that small amount of respite care, and then me coming in and taking care of my mother on the weekends when my sister needed to do things, that helped, but it still is a challenge. And but the more resources that can be provided to that caregiver, it's just going to make it a lot easier for the entire family. And getting the whole family engaged is very beneficial, because it's a 24-hour job.
So
Plus.
it sounds like how to get connected to your PCP, your primary care physician, and maybe what are the kinds of questions you should ask,
Right.
or information you should share. And then I think also, how do you rally the families and
Right.
friends to help with support? It sounds like
Right.
those are the topics that I was hearing as you were
Yeah.
talking.
Well, the respite is so important for a caregiver, and many caregivers don't have that family support. So having that resource of having an option to get respite is extremely important.
Right. Right. One last question here before we wrap up quickly. Did anybody access palliative services? And if so, how did you get them? Not hospice, but pre-hospice palliative. I know it's hard to kind of, there aren't a lot of resources available. I think it's an emerging area, particularly for dementia. But it was asked in the question, I didn't know whether anybody was able to access those. Or, Stephanie, maybe in your situation now, if you're able to get any palliative resources in play.
We have not, although my mom was on hospice last year for a while, which was a separate experience, but no, we haven't had separate palliative care services.
I think it's an area that, again, that we need more education on, and certainly more services available for that. So thank you all so much. I hope that, this was certainly, delightful for me to be with you all today. And I hope this is helpful. We've gotten some nice comments in the Q&A here from folks who've appreciated the talk. And so thank you all for doing this. And Sari, let me have you take us home.
Thank you so much. And just echoing my thanks to all of you for sharing about your lives as caregivers and working in the field. We appreciate you and your ability to teach us all about what life has been like for you. So I just want to let you all know that we will be meeting again for our next webinar, Expanding the Reach of Dementia Programs. on June 18th. If you have not received the announcement for that webinar, we will send it all out to all of you very soon. And if you have questions, you can reach us at the email address that you see on your screen, nadrc-webinars@rti.org. And with that, we'll say one last thank you to our panelists and moderator, and we will sign off for today. Thank you, everyone.